Hi everyone, welcome back to my channel. In this video, we are going to see some important practice questions from the section Coding Guidelines. As you all know, in the CPC exam, there will be 7 questions from the Coding Guidelines section. The questions will be asked from the ICD-10 official guidelines for coding and reporting, CPT coding guidelines and parenthetical notes and also modifier use. Let's start with the first question. Before that, don't forget to hit the like button, share this video and also subscribe to my channel CodeMed Mastery. So this is the first question. When is it appropriate to report codes for signs and symptoms in addition to a related definitive diagnosis? Option A, only when the signs or symptoms are not present during the encounter. Option B, when the signs or symptoms are routinely associated with the definitive diagnosis. Option C, when the signs or symptoms are not routinely associated with that diagnosis. Option D, only when the definitive diagnosis is unknown. And the right answer is option C, when the signs or symptoms are not routinely associated with that diagnosis. Remember that a symptom code is used with the confirmed diagnosis only when the symptom is not associated with that confirmed diagnosis. Next question. Which statement regarding lesion excision is true? Option A, lesion excision codes include removal of a lesion with margins and simple non-layered closure when performed. Option B, lesion excision codes are selected by measuring the greatest clinical diameter of a lesion, excluding the margins required to complete the excision. Option C, lesion excision codes include removal of a lesion with margins and intermediate closure when performed. And option D, lesion excision codes include removal of a lesion with margins and complex closure when performed. And the correct answer for this question is option A. Lesion excision codes include removal of a lesion with margins and simple closure when performed. This is a very important question. Lesion excision guideline is present in your CPT manual, integumentary chapter. Please highlight it. Next question. How are the diagnoses sequenced when coding for multiple fractures? Option A, multiple fractures are sequenced according to anatomic location. Option B, multiple fractures are sequenced in accordance with the severity of the fracture. Option C, multiple fractures are sequenced in accordance with the longest bone first. And option D, multiple fractures are always sequenced with pathologic fractures. The correct answer is option B, multiple fractures are sequenced in accordance with the severity of the fracture. An important tip for your CPC exam preparation is that whenever you see important guidelines like this, please make a note of them. Next question. What does the presence of a C instruction following a main term in the alphabetic index signify? Option A, the term should be ignored. Option B, the term is irrelevant to the search. Option C, another term should be referenced. And option D, the term is a primary diagnosis code. And the correct answer is option C, another term should be referenced. The C instruction following a main term in the index indicates that another term should be referenced. Next question. Which one of the following is an example of a case in which a diabetes-related problem exists and the code for diabetes is never sequenced? First, option A, if the patient has hyperglycemia that is not responding to medication. Option B, if the patient has an underdose of insulin due to an insulin pump malfunction. Option C, if the patient is being treated for secondary diabetes. And option D, if the patient is being treated for type 2 diabetes. And the correct answer is option B, if the patient has an underdose of insulin due to an insulin pump malfunction. According to ICD-10 guidelines, when there is an underdose of insulin due to an insulin pump malfunction, the code for malfunction is sequenced first, followed by the code for underdosing. Then code for diabetes is added as an additional code. Therefore, the right answer is option B. Next question. According to the repair CPT guidelines, what type of repair is reported when a single layer closure includes copious irrigation and extensive cleaning to remove particulate matter? Option A, simple repair. B, complex repair. Option C, intermediate repair. Option D, simple repair plus a code for irrigation. The correct answer is option C, intermediate repair. According to repair CPT guidelines, when a single layer closure includes copious irrigation and extensive cleaning to remove the particulate matter, it is considered intermediate repair. Next question. A cardiologist attempted to perform a percutaneous transluminal coronary angioplasty of a totally occluded blood vessel. The surgeon stopped the procedure because of an anatomical problem, creating risk for the patient and preventing performance of the catheterization. What modifier is appended to the procedure code? Option A 52, option B 53, option C 54 and option D 76. Modifier 52 is for reduced services, modifier 53 is for discontinued procedure, modifier 54 is for surgical care only, and modifier 76 is for repeat procedure or service by same physician or other qualified healthcare professional. In the question, they have given the surgeon stopped the procedure because of an anatomical problem. Therefore, we have to use the modifier 53, which is for discontinued procedure, because they have given that the surgeon stopped the procedure. Next question. What is sequela according to ICD-10-CM coding guidelines? Option A, the effect after the acute phase of the illness within 3 months of the initial episode. Option B, 1 month time frame after an acute injury or illness. Option C, an acute injury or illness right after it has happened. And option D, the residual effect after the acute phase of an illness or injury has terminated. And the correct answer is option D. A sequela in ICD-10 is a residual or produced condition that is a direct result of a past illness or injury. Remember that there is no time limit on when a sequela code can be used.